Okay, guys, the focus of your discussion is the laws, norms, codes as reference points for human acts. So we will be talking about the reference points for human acts. In other words, it will answer the question, what are the basis of what is good or bad in our society? So one of these is your natural laws. Guys, the important thing that you need to remember about the natural law is that it's almost synonymous or akin to your eternal laws. So again, guys, when I say natural laws, it is synonymous to your eternal laws. And when I say class eternal laws, these are laws because it is mandated by the divine being. It is mandated by God or by God of other religions. Okay, that's why it's referred to as eternal laws. The next basis class of what is good and the right is your civil laws. When I say class civil laws, these are laws that are made by humans. Okay, these are laws that are made by humans. So in our case here in the Philippines, who are the ones who make our laws, dear students? Who are the ones who make our laws? Sige,
The
ideas.
senators, sir.
Okay, one are your senators and then another one is you have your,
Congress, sir.
okay, so you have your Congress. So class, our body or our government is divided into the executive, the legislative, and then you have the judicial branch. No? So it is the legislative branch that takes care on the creation of laws. Now, if you will be asked if what is the highest law of the land, what is the highest law of the land, that would be your, what do you call that document, students? That pertains to your, what's the highest law of the land? Yes? Anybody? When I say the highest law in the Philippines, what is that? What pertains to the highest
Philippine
law?
Constitution, sir.
Very good. That would be your Philippine Constitution. Okay, so class, when I say highest law, it means that all other laws emanates or is derived from that law. So you have your 1987 Constitution. Okay, so class, the highest law of the land, 1987 Constitution. Kindly take note of that. That's important. Okay, now, other basis class that we have also for human acts is your cultural norms. And when I talk about cultural norms, class, when I say norms, di ba, oftentimes we commonly refer to this as nakasanayan or nakagawian, no? So these are products of time and space related concerns. Now, highlight time and space. In other words, class, when I talk about cultural norms, your cultural norms could be changing from one time to another, from one place to another. So again, as nurses, you are reminded that what might be working in culture A might not be working in barangay B. What might be working in culture B might not work in barangay A. Okay, kindly take note of that. Now, living conditions, class, and needs of a particular culture in the context of time and space it is happening. And then take note that it is ever changing depending on the cultural conditions around them. Okay, now, one example of this is if you would look at the people of Amazon, in the past class, these people would usually go to the forest, or these people class would usually hide. No? They would usually stay hidden in the forest. But because of the changes right now that is happening, let's say, for example, the global warming and then the melting of the ice caps, this has led for some generations actually to go out, okay, and then visit other places also. So that's one thing that they have been doing. Okay, so that means, guys, that there is no norm that will stay forever. One norm class may be effective today, one norm may be done today, but after 3 years, it might be different already on the part of your patient. That's one thing that you need to remember. Next class is the Code of Ethics. Now, Code of Ethics is a very important document. In fact, if you are a professional, you need to familiarize the entire contents of your Code of Ethics. Now, class, when I say Code of Ethics, it is a formal statement of the group's ideals and values. Okay, again, class, look at the word and highlight the words formal statement. Why? So class, when I say formal, it is made, it is formally written, it is a legislation that is made by a certain body. Okay, it's formal, meaning it's not just written anywhere else, but it's a formal document that is signed by its members. Now, when I say here group class, it refers to the profession of concern. It refers to the profession of concern. For example, you have the code of ethics for nurses. You have the code of ethics for teachers. You have the code of ethics for doctors. Okay, these groups class is your profession. Okay, now it will embody the ideals and then the values, and then shared by the members of the group, reflects their moral judgment over time, and serves as a standard for their professional action. Now, one way for you to differentiate, you might be confused now, since when I say civil law is also a legislation. But class, take note, your civil law is made by your legislative branch. So that would pertain to your senators and congressmen, as you've mentioned earlier. And then class, when you talk about civil law, one example of your civil law is RA 9173, for example. Class, your RA 9173 is your Philippine Nursing Act of 2002. That's the Philippine Nursing Act of 2002. Now, class, one thing is that, okay, later on. Class, for the Code of Ethics, for example, your Code of Ethics is a formal document. It is embodied, for example, in BON Resolution number 220. In our case, among nurses, BON Resolution number 220. Class, what is BON? BON is the Board of Nursing. Okay, class, your BON stands for the Board of Nursing. Class, the Board of Nursing is the board that is directly under the PRC, under the auspices of your PRC. So class, when I say PRC, it's your Philippine Regulatory Commission. Okay? Professional Regulations Commission, not Philippine Regulatory. Kindly correct that. That's your Professional Regulatory Commission. So class, what does the PRC do? If I need to renew my license, I am going to PRC. If you are about to take your board examinations, you are going also to PRC. In other words, all the professionals here in the Philippines are being regulated by the PRC. From your doctors, nurses, architects, all the professionals are in your Professional Regulations Commission, except for lawyers. Okay, the lawyers is being regulated by the bar. No? The bar, you have the integrated bar of the Philippines that are regulating the lawyers. Now, so class, when I say code of ethics, when I say first civil law, for example, you were not able to follow what is written in the civil law, or you became a pasaway and you did not follow what is indicated there, class, you could be punishable by, you could have penalties, or you could even have imprisonment. Okay, if you were not able to follow the civil law, you would have penalties and imprisonment. But if you were not able to follow the code of ethics, class, you would only have administrative sanction. You would have administrative sanction. Again, I would like to repeat that if you are unable to follow a civil law, class, the penalties could involve penalties as in fines in form of money, and then you would have your the other one that I mentioned, imprisonment. Okay, you can have imprisonment. But if you were not able to follow the code of ethics, class, for example, you would have administrative sanctions. Okay, administrative sanctions. Now, what is the purpose of the code of ethics now? So take note that this is shared by the members of the group. So when I say, for example, nurses, we have common code of ethics. It's common among nurses. So when we say that it is the part of our code of ethics to do good to our patients and do no harm, that is it. That's our role as nurses. Then it reflects our moral judgment over time. Okay? In other words, if there are things that needs to be prioritized, the nurses would go back to the code of ethics. One of the mandate, for example, of the code of ethics, or one of the sections there of the code of ethics, is talking about the nurse and the society. The nurse and society. What does it imply there? Class, that anytime that the society, the community would have the problem, the nurse should be able to address that problem, because the nurse has a moral obligation to the community. Next, it also serves as a standard for our professional actions. They serve as a standard for our professional actions. Now, if you've noticed now, it's actually considered to be an aggravating circumstance. When I say, class, aggravating circumstance, for example, you've committed a crime. If there is an aggravating circumstance would actually add to your penalties. Okay, an aggravating circumstance would actually add to your penalties. Now, if there is infidelity, let's say, for example, class, you are married. Okay, for example, no, you are married. I am also, for example, married. There will be a grave license. There will be a more grave penalty on me a more severe penalty on me because I'm already a registered nurse if both of us would become infidel. Okay, for example, no, we are unfaithful, for example, on our respective wives. I'm married, for example, and then you are also married. I will have more penalties than you do because I'm already a registered nurse. Are you getting the point? There is more penalty to a registered nurse because the code of ethics of registered nurses indicate that we should protect the family, the individuals, and then the society. If I will be engaging in an infidel relationship, infidelity, guys, in other words, for example, bigamy, okay, for example, I'm married and then I'm having another live-in partner, that's actually immorally wrong on the part of the nurse. If it would come class to lawsuits, okay, or napunta na siya, for example, sa judge, napunta na siya sa korte, the nurse class would have more penalties because the nurse is expected to promote love in the family members. Okay? Plus, take note that among the professions, your nursing profession, along with the teaching profession, is actually considered to have high moral transcendence. Kindly take note of that. The nursing profession, along with the teaching profession, would have high moral transcendence. So meaning the expectations to you of the public is higher compared to other members of the public. Okay? Now, other than that, class, your professional code of ethics is actually your contract with the society on how the professionals behave in accordance with the rule dictated by the society. For example, guys, no, you're walking inside the mall, and then you notice that somebody collapsed. If you are a nurse who is morally inclined to do good, what do you think is the best thing that you will do? Somebody collapsed. What do you think will you do if you witness it as a nurse? What's the best thing that you will be doing? Sige na, ideas? You can use the chat box, guys. What are the ideas that you have in mind? What would you do if you witness somebody to collapse inside the mall? Yeah, and you're there. Mentioned you've witnessed it. What do you think is the most prudent thing for the nurse to do? Sige na. When I say class the term prudent, okay, prudent class, when I say they use the term prudent, it is what an intelligent and a well-educated nurse would do. Sige, what do you think will you do if somebody collapsed? Sige na, I'm waiting for your ideas so that I will know. Okay, call emergency first, that's good. Others, approach the person and help check what's wrong with the person. With those two answers, class, you will already be able to retain your license. With those two answers, you will be able to retain already your license. That's good. You need to call the emergency personnel first and then approach the person and help. Okay? Now, class, in an emergency, the general guideline that we follow is you call for help first, and then you assess the patient, and then you intervene. Okay? Plus, why do we prioritize the call for help? Take note that you are the nurse there. You don't know if how many healthcare professionals are there. Now, if you will start assessing and intervening to the patient, it will come to a point that you can't do anything without the help of professionals. So you would need the help of professionals so that the patient would receive their best care. So that's why you call for help first. So that by the time that you, for example, has stabilized already the patient, the help is already available. Now, plus on the side, we are actually protected by one law when we respond to this one for emergencies like that. The law class is referred to as your Good Samaritan law. Class, when I say Good Samaritan law, your Good Samaritan law is actually retrieved from the story that in the Bible, that of the Good Samaritan. Plus, what does the Good Samaritan law tells us? That if you are a healthcare professional and then you have helped in an emergency, if you have done what a prudent nurse could have done in that situation, you are free from criminal liabilities. You are free from criminal liabilities. Okay? One example. For example, if Adaiza and I are nurses, and then we witness an accident. Okay? We know that if somebody is bleeding, what should we do, guys? If somebody is bleeding, what's your intervention? You need to apply If somebody's bleeding, what's your intervention? What will you apply, guys? Sige na, this is first aid. This is fundamentals. Apply?
Pressure.
Okay, very good. Apply pressure. For example, Adaisa and I are both nurses. And then we witness that somebody is bleeding. And then I don't have a gauze. Diba? We are taught in school, you apply pressure, you use a sterile gauze. Because your sterile gauze is clean, it would not allow for the presence of infection. Now, for example, Adaisa and I are there, and then we don't have a gauze. Of course, it's somewhere down the road. One thing that we could do is that, for example, I'd volunteer my handkerchief. And then I would use my handkerchief to apply pressure there on the site. Or for example, Adaisa would say she will tear down her clothes and then apply pressure on that side. We could not be held liable later on if there will be infection because my hanky or her clothes are dirty because we did our best on the time available. Because we did our best on the time available. We are protected under the Good Samaritan law. Okay, that's it. As long as you have done what's the best thing that could be done during the situation, you are free from criminal liabilities. Now, so this reminds us that ethics is important, is an important practical science. It's actually a practical science. Since it's science class, it's a body of knowledge. And take note that our focus here is how human acts are directed towards man's purpose or ends. So in other words, how does this act lead towards the end? How does this act leads towards the ends? Now, when you are learning ethics, take note that you need to familiarize with the terms means and ends. Okay? Later on, class, you will know that there is an ethical principle that says the means justifies the ends. And there is also another ethical principle that says the ends justifies the means. But for this time, class, just remember when I say means, these are the ways for you to attain the outcome. Class, ends is outcome. Ends is outcome. Now, example of means. If you would want to get high grades, one of the means is for you to study. So class, studying is a mean, and then getting high grades is actually the ends. Okay? Getting high grades is actually the ends. So it's just like, if you're talking in science, it's just like your cause and effect now. So your means class to your ends could be likened towards your cause and effect relationship. Okay? So try to remember that it is applicable in our future concepts. Now, class, when you talk about ethics again, it does not stop at the contemplation of truth, but applies that learning into action. Okay? Which means that, for example, guys, no, I've discovered that my companion is dishonest. Let's say, for example, let's pick a random name, Jose. And then Jose, class, I found out that Jose committed a medication error. Jose committed a medication error. Class, when you committed a medication error, what do you think is the best thing to do? Hide it or tell the truth? Hide it or tell the truth?
Tell the truth, sir.
Okay? You should tell the truth. You should tell the truth. Okay? Oftentimes, nurses kasi would say, hey, I don't want to tell the truth because it might lead to losing my license. No? So some will say, I don't want to tell the truth. I might lose my license. But actually, class, you're losing your license when you will not be telling the truth. Okay? You're losing your license even more when you're not telling the truth. Now, going back here to the short story we have with Jose. Class, for example, I'd known Jose has a medication error. And then I discovered it myself. Now, what should I do? Class, I discovered the truth that Jose had a medication error. And ethics does not stop there. Instead, I should be able to apply that truth into action. Now, if I am his senior nurse, I could tell Jose, Jose, you need to report that. Jose, you need to inform our superiors. Jose, you need to inform the doctors. If Jose will not be doing it, I will be the one to do it. Because ethics tells you that it's not about finding the truth, but also acting on this truth. So class, ang drama nyo dito, hindi lang the truth will set us free, but it is your actions that is beneficial to our patients. Because what use is the truth if we will not be acting on it? Then, your ethics also provide the necessary knowledge so man can choose what is good and consequently lead in a morally upright way. Okay, so para may basis tayo. Now, let's look at James Rest. So James Rest, an author, the four-component model of moral behavior. According to him, there are four elements during the data collection, and these four elements are psychological processes that occur before moral behavior would take place. Okay, again ha, sabi ni James Rest, there are four psychological processes that would happen before the moral behavior would take place. What are these four processes? You have SJMI. Okay, look at the terms SJMI. That's according to Reed. To Rest, I mean. Now, plus what's SMJI? SJMI, I mean. So you have sensitivity, judgment, motivation, and implementation. Okay, so you have sensitivity, judgment, motivation, and implementation. That's according to Rest. Now, according to him, you need to be sensitive, you need to have a good judgment, you need to have the motivation to implement it, and that's leading towards a moral behavior. So in other words, that goes back to what I said earlier, that it's not just about thinking. No? If I think I did right, that's the end. No. Okay, that's not yet the end. That's even just the beginning of your moral behavior process. Now, let's talk about moral sensitivity. Because when I say moral sensitivity, it's recognition that the ethical problem exists. Okay? Now, look at this, for example. If your patient class is bedridden, what is your intervention as a nurse? Di ba, class, bedridden? When I say bedridden, the patient could not move on bed, just stays there, lying down, and you know that your patient is at risk for bed sores. No, at risk for bed sores. What do you think, guys, will be your intervention? What do you think will be your intervention? What do you need to do to prevent it? Fundamentals.
I-change ang position, sir.
Okay, change the
Ang
position of
patient.
your patient. Very good. A class, or simply use, we say turn the patient. No? Turn the patient. And we do that every 2 hours. Now, let's say, for example, it is already your afternoon shift. You are in the afternoon nurse, and you've noticed that the patient has not been turned for the entire morning shift. The family reported that the patient was not turned for the entire morning shift. Others class would just say, so what? Bahala na. Hayaan mo na. Hindi na natin problema ang morning shift. Okay? Let's bother ourselves about PM shift. Now, that example is a lack of moral sensitivity. If you were able to recognize that there is a problem there, you could have called the attention of the morning shift nurse so that the morning shift nurse will not be repeating the same problem. That's your moral sensitivity. Okay? Because for others, it might not be an ethical problem, but for you as a nurse, it is an ethical problem. So you need to be able to see it. And this requires being aware of how the behavior would impact them. And then plus, they would require also identifying possible course of action. Now, you know that that example of mine na pinabayaan yung patient is not ethical. And you know that the course of action that you should be doing is to turn the patient every 2 hours. Then determine the consequences of each potential strategy. One strategy that you might have in mind is approach the morning nurse. Diba? We need to approach the AM nurse. Now, one thing that you need to think of is, will she listen to me? Will she take this properly? Or she might get mad at me? Okay, so you need to understand the consequences. Would it be wise for me to tell my head nurse, or shall I deal with this on my own? Okay? Class, if you would look at it in the hospital setting, textbooks would tell you that if you have a problem with your companion, the next best thing is you refer to your head nurse. You refer to your head nurse. Plus, by experience, I can tell you that it's wise first to talk to your colleague. It's wise first to talk to your colleague. For example, Sarah here. I don't like Sarah, for example. We are working together. I can tell Sarah, don't say, Sarah, I don't like you. That's very offensive. Okay? You're making the focus to be Sarah. But instead, class, you can say, Sarah, I don't like what you did this morning. Sarah, I think you missed turning the patient. In other words, I'm telling you that I am not mad to Sarah herself. Instead, class, I'm actually mad at the actions that she have done or failed to do. Do you get my point? Are you getting my point there, class? Okay, we don't get mad to the person, you get mad to the behavior. We do not reprimand the person, we reprimand the behavior. Because by the time I will say, Sarah, you are a very useless nurse, that would hurt Sarah, and then that would not be beneficial for both of us. But if I will say, Sarah, I think you missed turning the patient today. So Sarah would say, okay, next time I will just turn the patient. Thank you for reminding me. Okay? That's how you address concerns in the hospital. And then plus we say that your moral sensitivity is also key to transformational effects. So take note of that. Una sa listahan is sensitivity. Then next, moral judgment or reasoning. So class, judgment. Since you're already using your judgment, you choose which is a better attack or approach. Will it be option A, option B, option C? And actually, if you're a nurse, no, we're actually preparing for options A to Z actually. Okay? For you to approach the situation. Then class, you are making a judgment. What's the right thing to do? For example, in the example earlier about Jose, who committed a medication error. Okay, what's the right thing to do? Will I befriend Jose and tell Jose, hey Jose, give me a lunch later on. I will not be telling the head nurse about this. Or should I tell the truth because that is what is best for the patient? Okay? By the way, class, on my example on medication error earlier, so that your judgment will also be guided. Class, in medication errors, take note, once you've informed the physician class might be able to give antidotes. So when I say class antidotes, these are medications that could reverse the effect of the one that you have given. And then class, the physician will be able to monitor closely for adverse effects. And the physician class will be able to monitor closely for adverse effects. Okay? For example, class, in my case, I could not tell you that I am really a very good nurse who have not committed any error in the clinical setting. Okay? It's not an excuse. It's not a proper excuse to say, sir, tao lang naman tayo. No? Or oftentimes you will say, tao lang naman ako, nagkakamali din ako. That's not a proper excuse. That's not a proper excuse. But I'm telling you, class, that I've also committed errors in the medical setting. And then, class, there's nothing wrong if you will tell the truth. In fact, class, by the time that you will tell the truth, the burden is off your shoulder. Okay? You won't have the guilt, no? Rather than for you not to sleep at night because you've given a wrong medication. Now, that's your form of moral judgment. Then moral motivation. Are you motivated to follow through on their choices? Okay? Are you motivated to do it? Okay? Are you motivated to have job security? Because class, when I talk about moral motivation, moral values class would often conflict with other important values such as job security, career advancement, social acceptance, and then wealth. Look at the example that we have with Jose earlier. Class, Jose committed a medication error. By the time students that I will report Jose, what do you think will Jose think of? Do you think we will be close friends or not? What do you think? Will we be close or the tendencies that we will argue? So class, the tendencies magtatampo, di ba? Magtatampo. Okay? So, kumbaga, mauluogtas, kay tigin-sugid-sugid ta siya, no? That happens. So class, moral motivation is telling us that even if there are consequences, even if I might lose my relationship with Jose, I need to do it because this is the truth. Okay? Now look at other examples there. Career advancement. Okay? For example, class, that is a particular example if you're dealing with your boss already. Okay? Let's say, for example, you've noticed boss and boss committed a mistake. Or boss is telling you, for example, hey, Tarin, do this. But you as Tarin knows that, no, that's wrong. I won't do that. And then she would threaten you. I would not be promoting you if you will not be doing this. Di ba, you will be thinking, oh, anong gagawin ko? What will I do? Will I follow him for the sake of promotion? Or will I not follow him because I know what's right? Okay? So class, moral motivation tells you that even if you will sacrifice job security, career advancement, social acceptance, okay, you need to stand. You need to stand on what is morally right or wrong. I think you have seen this in movies, or I don't know, in series maybe, that you're looking at. Okay, for example, we'd have money, what do you call that, money laundering, or let's say, for example, stealing wealth. If I'm your boss, for example, and I'll tell you, Steven, hey, Steven, let's steal money. Please sign this document, which releases money worth 1 million to us. I'm your boss, Steven. And then Steven would sign. Class, who will be held legally liable? Is it Steven, me as his boss, or both of us? Steven, me as boss, or both of us? Sige na, who will be held liable? I told Steven, sign this document. Money will be given to us. It will be 1 million. I will give you 250,000. I will give you 250,000, Steven. Okay? So class, who will be liable? Somebody is answering Steven because he signed the document. Okay? That's one good point. But class, actually, both of us will be held liable. So what I'm telling you here is that if you will tolerate an illegal act, if you will tolerate an immoral act and then not report it, if it will come later on to court, you will also be held liable. And for example, if Steven would reason out, no, I just followed my boss. You know, Sir Gilbert is my boss for 5 years. I need to follow him. Okay, I respect the guy. Okay, even if Steven respects me, if I'm telling him something immoral, he must not do it, or else he will also be held liable. Okay? Now, no, those things might be easy for us to say, but I tell you, they are difficult to stand out for. Okay? Difficult to stand for. So I hope that if you will have the moral motivation later on, I hope that you will have the moral motivation later on to stand on what is right. Huh? That's why, class, one thing that you need for you to have the moral motivation is for you to improve your knowledge base. Improve your knowledge base. It's very difficult, guys, to survive. This is side topic. It's very difficult, class, to survive in this world if you don't have the idea on what's happening in this world. Okay? For example, if Steven does not know anything and then would say, he's my boss, I will sign it. Because I'm just following orders of my boss. So Steven does not know. But class, take note, in the law, ignorance of the law excuses no one. You write it down. Ignorance of the law excuses no one. Ignorance of the law excuses no one. What does it mean? You could not go to the court and then say to the judge, Judge, I did not know that there is such law. Okay? If you don't know there's such law, it does not excuse you. Okay? Steven could not go there and say, Judge, I just followed my boss. No, that would not work. Okay? Then class, moral character. Take note that executing the plan would require moral character. So, overcoming active oppression, then cope with fatigue, resist distractions, and develop sophisticated strategies for reaching that goal. Okay? In other words, guys, when I would want to do something morally correct or morally right, it is not just a one-step journey. It needs to be a plan. It needs to be a plan. For example, if you're dealing with family members, the example that I've given earlier is something like on the line of cancer. For example, if the family member would want to go aggressive, in other words, the family members are saying, give everything, treat my mother, give her all the cancer drugs that you can. And then the patient is saying, di ko na kaya, please stop. As a nurse, you don't just say, I will follow the patient, never mind the family. That's easier said than done, class. But come to think of it, in the setting, in our setting here especially, it's usually the family that's spending for the patient. If you will not be following the patient's or the family's wishes, okay, you're fighting the wrong battle. So what do you do? No? For example, you need to arrange for family conferences. When I say class family conferences, you call for the family, you call for the patient, you call for the doctor. Allow them to talk. Okay? Allow them to talk if what are the priorities. What will happen if we will proceed with treatment? What will happen if we will stop treatment? So that they will be able to realize the risk and the benefits of the situation that they are getting into. Okay? That's one thing. That's one thing that you need to remember. So it's not a one-way ticket. So you need to execute a plan. Okay? Now, this draws back to the question, what is ethics? So class, ethics, for the many origins, may that be from the Greek word ethos or ethos. So class, it stands for customs, ways of behaving, and then behavior. Latin counterpart is mores or moris. No? So when I talk about ethics, these are basic human behaviors that are specific and inherent to human beings. As you can see, we're not dealing with the ethics of animals. If you can notice, are we talking about the ethics of animals? We don't. but we talk about the ethics of humans in dealing with animals. Diba? So if you can notice, our focus is the human beings. So they are natural to humans, which confers and develops goodness in them. So it's natural for us to be ethical. Then, what is nursing ethics? Class, your nursing ethics is actually considered a subset of healthcare ethics. In other words, the big house there is ethics. Under the big house of ethics, so you have your healthcare ethics, and then under your healthcare ethics, you have your nursing ethics. Okay, so it's a subset of your healthcare ethics. So it's applied discipline that studies the ethical dimensions and issues in nursing practice. And it is also a basis for the professional code of ethics, which specifies a system of principles and rules for resolving dilemmas. No? So later on, class, you will know there are already ethics committee in the hospital, and the ethics committee, class, would help decide on what is best to be done in a certain case. I don't know if you're watching Grey's Anatomy. I would usually tell my students and encourage my students to watch Grey's Anatomy because it teaches you how a hospital would actually run, no? The reality in the hospital setting. One thing there, class, that you can notice in Grey's Anatomy is that, for example, a doctor would want to do something to the patient. Let's say, for example, Dr. Gray maybe would say, hey, we need to operate this patient. But then the mother would refuse the operation. So what's the best thing to be done? It's the ethics committee, class, who will discuss. No? So who will be followed here? Of course, it's the mother. But then if the mother is financially incompetent, if the mother does not take care of her child, who would do this? Okay, so those are the things that the ethics committee would look into, which means, class, that there are principles and rules that guides us. Okay, I could not just say, hey, I feel like I want to do an operation. Hindi pwedeng pa-feel-feel lang dito, guys. Hindi pwedeng pa-feel-feel. So we need to have ethical basis. Okay, in our setting, for example, and in all settings abroad and in the Philippines, for example, if a patient would come unconscious in the hospital, unconscious ang patient sa hospital, di ba, class, the principle that we are emphasizing is that you need to ask consent for the patient. Before you do any procedure, di ba, sir, mag-i-insert ako ng IV, sir, I will check your vital signs. Pag magambal siya, no. Pag sinabing no, di ba, you would not proceed? Di ba, you are taught the same? Are you taught the same in fundamentals and health assessment? But class, if you would look at it, unconscious ang patient. Unconscious, walang malay. Can you awaken the patient and then ask, sir, mag-i-insert na ako ng IV? Or if the patient, class, has no pulse and not breathing, could you just say, sir, I will do CPR? So that's not how it works. No? We know, class, that if the patient is unconscious, we need to act on the patient. We need to help the patient on the best thing that we can. Okay? If the patient is unconscious. Okay, kindly take note of that. So that's what we refer to as your implied consent. Implied consent. In other words, class, you need to give the best care even if the patient did not verbally tell you to do so, because that's an implied consent. Now, love, class, your nurse practice acts and then your code of ethics. So, class, code of ethics, as mentioned earlier, I mentioned to you Bond Resolution 220, and then, class, your nurse practice act. So before, class, you have your RA 7164. It was replaced already by RA 9173. The new nursing act is RA 9173. So students, code of ethics, it's the one that tells us the moral ideas. It provides us the guidelines on what is ethically good behavior, and it holds the nurses morally accountable for their actions. What did I say earlier is the punishment if I will not follow the code of ethics. What is the punishment, guys? If you will not follow the code of ethics, you will have?
Penalty.
You will have, again, sorry?
Penalty.
Okay, penalty.
Administrative
Administrative
Okay.
sanction,
So class,
sir.
code of ethics, class, administrative sanctions. Admin sanctions. Class, when I say admin sanctions, by the way, I was not able to expound earlier. This, class, means that your license may be suspended or your licensed students may be revoked. So this means, class, suspension of license or revocation of license. But if you were not able to follow the Nurse Practice Act, your Nurse Practice Act is actually a civil law. Okay? And actually, class, it's a special law. It's even a criminal law. So class, if you were not able to practice to follow your Nurse Practice Act, you will have penalties and you could even be imprisoned. Okay? For example, just as an example, for example, if Rhoda here would go to the hospital and say, hey, I'm a nurse, whereas Rhoda is actually a student nurse. So Rhoda class could be held liable, especially that she is already of legal age. Okay, so those are some of the examples that would tell you that you need to follow both the Code of Ethics and then the Nurse Practice Acts. Okay, do you have any questions so far?